came into it because I was looking at patient portals and I was saying, we need to fix these patient portals. And very soon, people from Open Notes reached out to me and said, we agree that there's problems with patient portals and we need your help. And my story is that in 2009, I had what I considered an ordinary joint replacement. It was my 5th joint replacement. This was a knee replacement, and I thought I knew everything about joint replacements. I knew you'd go to the hospital, you had the joint replaced. 3 days later, I would go home. I usually had 1 or 2 physical therapy appointments. I always went home with my doctor's note to say when I could go back to work because my job was working with children and with teachers that taught children. And I wrote curriculum and worked for the Diocese of Green Bay, Wisconsin. So if anybody's a Green Bay Packer fan here, I come from that area. I'm a big Packer fan, and my office used to overlook the Packer Stadium. But anyway, so I thought my knee replacement was going just as normal, except about 10 days after my joint replacement, I started to have some drainage around the staples. And so the night that I went in to have the staples removed, it was a Thursday evening, I said to the doctor, I've been having this drainage around the staples. And he said, oh, once I take out the staples, everything will be fine. It'll go away. Well, this was Thursday night, and Friday morning I went into work, and by noon I had to change bandages 4 times. So I decided that maybe I should take the afternoon off and went home and decided to put up my leg for the afternoon, hoping that would help the drainage go away. But only got worse. And so by Saturday morning, I was wrapping my leg in a bath towel. By Sunday, in a beach towel. But I kept hearing him say, it'll go away, it'll go away. Well, Monday morning, I knew I couldn't go to work. There was no way I was going to be able to go to work. So I called him and said, I think I have a problem. I think there's something going on here other than just normal drainage from a staple. And he said, well, come on in. So I went in at 1 o'clock that afternoon, and he looked at it and he said, oh, I think we need to change out the hardware. And so he said, be at surgery tomorrow morning at 7 o'clock. Come in at 5, we'll do surgery at 7, and everything will be fine. Everything will be fine because we'll change out the hardware and everything will go fine. Well, I don't remember anything of that day. I don't remember anything of that that Tuesday. And on Wednesday morning, a new doctor was standing at my bedside. And he probably said a lot of things, but all I remember him saying is, lady, you're very ill. You have an MRSA infection, and I give you about a 30% chance of surviving this. Now, I am a survivor. I had survived 3 types of cancer in my life. I had survived uterine cancer, breast cancer, and I literally have a rib and titanium plates in my face. I have had Face Off before the movie Face Off came out. So I thought, I'm a survivor. But little did I know that this survival was going to be very different than ever before. I've had 58 surgeries, multitudes of cleanouts of the wound over and over, sometimes twice a week. I've been hospitalized more than 200 times. I always say I've seen the good, the bad, and the ugly. I've been in septic shock more than 15 times, and I've had 3 amputations, and I'm amputated all the way to my waist. I have a little bit of pelvic bone left, but that is infected with MRSA. And so what I opted to do was have the tissue around the pelvic bone removed. So I kind of sit on my right side, on my left side, because I don't have much tissue to sit on my right side. But along the way, I started to use my story to help others. And very quickly, even after my first amputation, IHI heard about my story and said, we're looking at joint replacements and we're not getting anywhere. Would you help us? And so the day after I came home from my first amputation, IHI came to my home and they made a video called One is Too Many. It's on YouTube. I always say if I would have just got 1 penny for every time that video is played, I'd be a rich woman. But they made this video called One is Too Many. It's an 8-minute video. It's used by a lot of hospitals and healthcare organizations across the world for orientation about hand hygiene, infection control. And very soon, IHI and many others invited me to the table. I presented at the last 14 IHI conferences in Orlando. And then last year I presented in Copenhagen with the patient group, and this year I presented on What Matters to You in London, and that's why I'm here, still here. One of the people I met along the way is my good friend, Liz. And Liz has had multiple surgeries on her brain for brain tumors. And she was a big proponent of open notes. She was doing research in open notes. I was doing research with the University of Wisconsin in infectious disease. And so the two of us compared a lot of notes together and decided that we needed to start doing presentations together. And so we started talking together, sharing things together, wanting to be together, shared our story multiple places. As Liz will tell you, and that's who John heard in Australia. Liz was in Australia, and before she had her last surgery. She had a brain surgery about maybe 4 or 5 months ago, and so since then she's not traveled as much, and that's why she said to me, Rosie, would you go do this in London, and seeing you're already going to be there. When Liz and I first met, I was looking at patient portals, and I was saying, we need to fix these patient portals. I live in a rural area. That means there are no taxi cabs, there are no trains, there are no, basically you get around by car. And at the point of when I met Liz, I had literally 7 patient portals. Now, most of them were Epic, but yet nobody was working together. So I was saying, why do we have to have all these patient portals? And why do we have to, why can't we put them all together in one place? So I was then working with Liz and Open Notes, and they were asked to present at the EPIC conference. Now, Liz works for Harvard, so they were going to let Liz in, and they were going to let the 2 doctors that we were working with in, but they weren't going to let me in because EPIC doesn't consider my patients their customers. EPIC considers the health system their customers. And so the 2 doctors said, if you aren't going to let Rosie in, then we're not going to be coming to talk to you because we feel that her story is really convincing us that open notes is important. And this notes and keeping the notes are going to be extremely important in the future. And so I spoke with them at this conference. I also taught a lot of doctors how to write notes. Many times doctors would write their notes, and I'd say, a patient isn't going to understand this. The patient isn't going to understand one word of this. You need to write notes that are going to be helpful to the patient. And one of the reasons I said this was because I lived literally from one of my physicians, I lived 75 miles away. And if I wouldn't have had my patient portal to send him pictures and questions, I would have sometimes traveled 75 miles one way just to get an answer to say, oh, it's nothing to worry about. Or, sometimes he would say, oh, you need to come in right away. The other thing, it gave me the ability to communicate not only with my physician, but with other, physical therapists, with spiritual leaders, with mental health leaders, with my primary care physician. It also gave me my notes, One of my stories I always talk about and shared it with at the day that I met with Epic at that conference was that I have a patient portal and I have a port and I have a and but yet they would draw blood. And sometimes they would draw blood on Monday, and they'd draw blood on Tuesday, and they'd draw blood on Wednesday, because every doctor would draw blood. And then finally, I'd say, my patient portal that I have on Monday will give you the answers that you might need on Wednesday. Why are you continuing to draw blood? If you really believe on, return on investment, and let's think about how many times you're going to draw blood up from this woman, and you're going to get the same results. And so that was one of the ways I convinced physicians to start looking at maybe notes are important. Maybe telling patients about their notes and about sharing their information and getting patients to look at their portals was important. I have to tell you that when it became law, open notes became law on April 5th of 2022. It was supposed to come earlier, but because of the pandemic, it took until April 5th of 2022. And when that became law, it changed us and it changed patients' use of portals, and it also changed the use of physicians convincing their patients to use portals. But along the way, Open Notes had been convincing physicians, this is a good thing, this is a good thing, this is a good thing. And I remember talking to physicians, and they were like, I'm just going to be bothered by these patients. They're just going to keep calling me because now they can see what I wrote about them, and they're just going to keep calling me. And I kept saying, not if you write the right kind of note. If you write the right kind of note, it's going to be helpful to them, and they won't be calling you as much. They won't be asking all these questions. And one of the things that happened was in 2020, we had about 52 million people using their patient portals. In 2022, and it's still growing, but in 2022 and 23, we have 331 million people using patient portals. So it's made a big difference. The law made a big difference. Now, I have to tell you that the law came with a stiff fine for health systems that don't use electronic records. And so if you don't have electronic records and you don't use the electronic records and you don't encourage your patients to use the portals, then you can incur a very high fine. On the other side of it, though, is that there are many, many foundations helping hospitals and healthcare systems put in the electronic records. I work with an organization out of New York that is a foundation for New York, and over the last couple of years, at the beginning we helped some of the health systems put in their electronic records. But in the last couple of years, it's been like psychiatric clinics or a Jewish committee or a community healthcare system or some simple little community organization that serves the community. And so they have put in their electronic records. And last year when I was looking at there were 16 people that applied. And I'm like, well, I want to give all 16 of them money because all 16 of them have a valid reason to want to be asking us for money. And so we figured out a way to give all 16 organizations money in a way that they could then make sure that they were using electronic records in the appropriate way and providing their notes to their patients. And that the notes no longer are just about their health, but now it's sometimes about social needs and social insecurities or social, like they might look at food insecurity or housing insecurity or utility insecurity or transportation insecurity. Many times in the area where I live, people just don't have the ride to get to their appointments. And so we've looked at ways of bringing health care to their homes, but also providing health care rides and being able to pay for those rides with different funding from the government and from Medicare and Medicaid. One of the things that people thought about open notes, they thought it was only for the people who have lots of education. And it wasn't designed ever for that, but it was designed for people who had less education, who were non-white, who didn't always get the same kind of treatment and didn't get the same kind of care that they felt they needed to get. And for older adults, for myself and for other people my age who are older and getting older, and then also many people that didn't speak English, because Epic, and most people don't know this, but Epic can be given to you in 32 languages. So basically, any organization that has Epic can say, these are the languages that are important to us, and here's the languages that you can use for them. And so you can say, I want it in Spanish, in Hmong, in some kind of Indian or Middle East, or whatever languages you want, and they will provide it. I think the other thing is that there's lots of benefits to it. And one of the things is that you have a better understanding of your health conditions. You have more control of your health. You are going to be, Sam talked about this morning about her son and him managing part of his health care. That's important to patients. For me, it was a learning experience. I had to become a patient. I was never patient in my life, and now I have to consider the fact that sometimes I have to just be patient and go with the flow. But I also know what I can do and what I can't do. It also gives them a recall of their visit and helps them understand the visit. You know, sometimes you think you've heard everything the doctor said, and then you get to look at your notes and it's like, oh, that's not what he said. It improves your medications and the taking of your medication. It reduces, your notes reduces readmissions. And I don't think most people think about that. It also improves the communication between clinicians and other care partners. So it helps you connect with your care partners and the clinicians. It's building trust. You know, the pandemic definitely destroyed a lot of trust in our medical and doctors, but the notes do build trust again and helps build that trust. It is being reminded of the next steps. What is the next steps in your appointment? I saw several people talk about that. What are the appointments that you have coming up? But it's so much more than that. It's sometimes reminding you that you might need a mammogram, or you might need a colonoscopy, or you might need a flu shot, or whatever it is. And then it's finding, you have the ability to say, you know what, there's an error in my record. And I can tell you that probably the place you find the most error is in your medication list. If Epic ever fixes the medication lists, we'll all be happy people. Every time I go to a physician, I'm like, why have I told you over and over that I don't take this medication? I haven't taken it in 10 years, and yet it's on my list. And yet, you know, you have the ability to say those things, but also to find errors. I have heard people say to me, you know, I went to the doctor with this concern, but everything in my open notes says, or in my summary says, talks about everything else but the reason I went to the doctor. And so, you know, basically, we're working really hard, and Open Notes is still working very hard to fix that, so that you as a patient can say, here's the reason I went to the doctor, here's the way that I need you to fix my notes, And here's the things that I wish we would have talked about in my doctor appointment. So, it's going to help fix those errors in our notes long before we know about them. This is my husband, David, and I lost him during COVID. He was my caregiver. He was my all be all and was all. He at the beginning of COVID, he had a backache. And if anyone knew David didn't go to the doctor unless it was severe. And so he went to the doctor like in March, early March of 2020, and he said he has this terrible backache. And the doctor said, well, it's probably because you and Rosie aren't traveling as much as you usually do, and you're not pushing her wheelchair. I didn't have a power chair at that point because he always pushed my wheelchair. People would call him my VIP, my very important pusher. And so he would push my wheelchair, and he was known as being the person who was always there for me. Well, as time went on, his pain got worse and worse. And I remember him saying when he came home from that doctor appointment, I'm not going back to him because even though he's been our doctor for 20 years, I feel like I was a bother to him today. And so he didn't go back to him. And eventually I said to him, well, maybe we should try a chiropractor. And so I called a local chiropractor, and we had never been patients of the chiropractor, but we called, and he said, well, I'm seeing patients, but I have no staff, but I am seeing patients. So David went in to see him, and he probably went to see him for about 4 or 5 weeks, 2 or 3 times a week. And about the fourth or fifth week, he said, I'm not helping you. I'm only making things worse. I think you need an MRI. And David said, well, I've already been to the doctor, and the doctor said that I'm not getting enough exercise, and it's my fault. And he said, well, let me call the doctor. And so the chiropractor called the doctor and said, I believe this man needs an MRI. So on June 26th, David went in for an MRI at 7 o'clock in the morning. And at noon, he gets a phone call from the doctor's office and said, you need to come in this afternoon at 1 o'clock. Now, it's COVID, so that means I couldn't go with him. And so he went into the appointment. And after the doctor walked into the office and said to him, I can't believe I have to tell you this, but you have 2 kinds of bone cancer, and it's secondary to something else. And so when he got in the car, he said, Siri, tell Rosie it's cancer. And that's the message I got. Now, the doctor was 45 minutes away, and so for 45 minutes to an hour, I kept texting and texting saying, what kind of cancer? What's the prognosis? What can we do? How can we, what's the next steps? And by the time he got home, he said, well, first of all, they don't want to do any testing until after the 4th of July. And I said, oh no, we're not waiting till after the 4th of July. We are going to do something now. I already was seeing an oncologist, oncologist, because of all the blood transfusions I'd had. My blood had really taken on them. I had developed several anemias, and so because of that, I was already seeing a hematologist. And so I said, I called his doctor and said, I need a referral to this doctor. And he said, well, give me the number and the name and the fax. And I said, I will give you that. He said, I'll fax it on Monday morning. And I said, I'll call him on Monday morning. So when I called him Monday morning, they said, Rosie, we just had a cancellation for tomorrow morning at 11 o'clock. Do you want that appointment? And I said, definitely. And I said, here's the doctor's name. If you don't get the referral, call me back. I'll get you the referral. Well, by the time the day was out, they had the referral. We went in at 11 o'clock. By 4 o'clock that afternoon, we knew that he had liver, pancreatic, gallbladder, upper GI, and stomach cancer, All of them were terminal. All of them were he had less than 6 months, probably on the short end of 6 months. They didn't know what was the primary. They could offer him one of two things: hospice or what they called comfort chemo. And that by that they said it might help with the pain. And so he had one dose of comfort chemo. And at the end, he said to me, Rosie, when those first drops of comfort chemo went in, my pain got so much worse. And my granddaughter's an artist, and the pain that we saw in his face and we saw in his eyes as he suffered that last month, because on July 28th, we lost him that morning. But the pain that we saw in his eyes are the pain that she portrays in that picture. That happy man that always was by my side with a smile went through so much pain those last days. But he died with so much grace, with so much love, and we spent that last month together. My 7 grandchildren, my 3 children, and he would rally. He would rally when anybody came to the house. His brothers didn't think he was dying, because he would get in the chair and he would tell his story and he would say what was going on. But people would say, "Are you afraid of dying?" And he would say, "No, because I've lived a good life. I'm afraid of what I have to go through to get there." And one of his last things he said to me was, "Rosie, you need to keep doing everything you're doing, and I think you can do more." And so why am I here? Was I in London? Why am I doing the things I do that are kind of crazy? During COVID, I presented on 6 of the 7 continents virtually. I presented, in Brazil, in South Africa, in Singapore, in several countries in Asia, several countries in France, in Spain, in Belgium. So why do I do that? Because I hear him whispering in my ear when somebody asks me to do something. You can do it. You can do one more thing. And so I believe that I can do one more thing. One of the things that we learned early on is that, and one of the things that we're working really hard is to make sure that the people that love you have access to your electronic records and to your patient portals. And that they call it proxy. We are hoping to change that to shared access, because it's really, really important. And Open Notes has been published in a multitudes of journals. These are some of them, but also one of them that's not listed on here is one that is put out by the Bartel Institute, and it's called the PX Journal, Patient Experience Journal. And I have written for it, and I've written about my experiences as a patient during COVID, but I also wrote about his diagnosis and David's patient portal's notes and the doctor's notes that he wrote that were so beautiful and were so important to us that we felt as a family we had done the right things for him. I have a book. I have a few copies here. If anyone likes a copy, please let me know and I will give you a copy. But also, if you email me, I can send you a copy. And also, Open Notes has a website. They are always they're still researching, still doing lots of great things. Liz and I are on multitudes of committees that work on Open Notes on a regular basis. And we do focus groups, we do webinars, we do lots of different things. But, Open Notes, when it became a law, really helped us push not only the Open Notes and the patient summary to the forefront, but also pushed patients' records to the forefront. So it not only helped us with the patient's notes, but also all of the records. Thank you, and hope you have a good rest of the conference.